Good morning. I'm Dr. Michael Bozak from the UPMC Heart and Vascular Institute. On behalf of UPMC, I want to welcome you here today. We are delighted to have you with us for this important presentation, and we appreciate everyone respecting our request to be socially distanced and to wear masks where appropriate. It's our privilege to work with Mayor Pappenfuss, the Harrisburg Police Department, and the Peyton Walker Foundation to create heart-safe communities by eliminating preventable deaths from sudden cardiac arrest, which is the third leading cause of death in the United States. When sudden cardiac arrest happens, quick actions such as implementing CPR and treatment with an automated external defibrillator, or AED, greatly increases the chances of someone surviving. Therefore, it makes sense to put these tools for survival in the hands of those who are charged with keeping our citizens safe and who are most often first at the scene when sudden cardiac arrest strikes. This is our local law enforcement. UPMC is honored to present these life-saving devices to the Harrisburg City Police. Here to talk about the effort and the reason behind 3.2 to protect the blue and the donation of the Harrisburg Police Bureau of Police, please welcome Kathy Flynn.
Good morning. I'm Kathy Hogan Flynn, Director of Emergency Nursing, UPMC Pinnacle, and this is Nicole Gout, Unit Director of the UPMC Pinnacle Harrisburg Emergency Department. For the past 2 years, nurses in the UPMC Pinnacle Harrisburg Emergency Department have honored the Harrisburg Police Department by hosting an annual 3.2 to Protect the Blue race at City Island. The goal of this event is to purchase life-saving equipment for Harrisburg police officers. The 3.2 to Protect the Blue is a typical 3.1 race with a significant modification. Runners go an extra 0.1 mile in honors of officers who have fallen in the line of duty. When the UPMC Pinnacle Harrisburg ED nurses learned that the Harrisburg City Police only had 2 AEDs for the entire department, we chose to direct the proceeds from last year's event to equip more police cruisers with AEDs, allowing our first responders better resources to react to medical emergencies that require defibrillation.
In partnership with the Peyton Walker Foundation, UPMC is honored to donate 18 AEDs to the Harrisburg Police Bureau. We are thankful to the UPMC Pinnacle Foundation who generously matched the event proceeds. This match not only supported the purchase of the AEDs, but also ensures the equipment will receive required maintenance to keep it working well into the future. It's so timely that these AEDs are being presented during Emergency Nurses Week, which this year carries the theme Heart of Gold. Our emergency department nurses know that the best way to improve chances of survival for victims of sudden cardiac arrest is early defibrillation. Our nurses have truly put their hearts of gold on display this year and are so grateful for the opportunity to work with our community partners to ensure timely care is provided when an AED is needed. And now to talk about UPMC's ongoing partnership with the Peyton Walker Foundation, I'd like to welcome Jessica Richie, Vice President of the UPMC Pinnacle Foundation.
So up until 2015, UPMC Pinnacle Foundation used to receive requests for AEDs in the community, and it was a lot of requests. And it was a lot of work to buy them, to make sure they're maintained. And then I met Julie, because she was working with Dr. Bozak and his team with heart screenings for kiddos. And she was driven by Peyton's legacy and super passionate, and frankly, she's just a lot of fun to be around. We agreed to create a partnership where we provide funding for AEDs in the community, and we would send any requests we receive for AEDs to her team. And I'm so proud to say that over the last 5 years, UPMC Pinnacle Foundation has provided over $172,000 to the Peyton Walker Foundation to provide hundreds of AEDs throughout Central PA. When Nicole said that she really wanted this year's race to support AEDs for the Harrisburg Police Department, and she asked if we could help, I told her, I know a person. So it's my pleasure to introduce that person and thank her for allowing us to partner with them to do this good work. My friend Julie Walker, Executive Director of the Peyton Walker Foundation, and Peyton's mom.
Since losing my own 19-year-old daughter to sudden cardiac arrest in 2013, I've met so many families who've also lost a child or a loved one to sudden cardiac arrest, and most often, during the cardiac arrest, there was not an AED available. AEDs are a critical tool to saving someone who's in cardiac arrest. Survival rates are less than 10%. and we have got to figure out how to do better. Partnering with UPMC to place these 18 AEDs into the police cruisers will have a tremendous impact, saving lives on the people who live here, the people who work here, and the people who visit Harrisburg. Not only will we love to see all police departments stocked with AEDs throughout the Commonwealth, knowing that we've got the Harrisburg Police Department covered is a win. We're grateful for UPMC, the emergency department nurses, for taking on this cause of action, and for the foundation, Pinnacle Foundation, for recognizing the importance and prioritizing making AEDs accessible. Working together, we're protecting hearts and saving lives so that the beat goes on. Thank you.
This is awesome on behalf of Mayor Pappenfuss, my police officers, and myself. This is a homecoming for me because a lot of you don't know, but I got my start in police work right here as security supervisor at Harrisburg Hospital. And I always had the greatest respect and love for emergency room nurses. They are so awesome because of the work that they do, but not only the nurses, but the doctors. And over the past couple of years since I've been leading Harrisburg police agency, the emergency room nurses and the foundation, they have always partnered with us to do awesome work. And the Peyton Walker Foundation, UPMC, we thank you very, very much. This will come in very, very handy for us. And now we need you to help us to train us on this stuff, but we do thank you, and thank you for being here. Thank you.
Hello, I'm Dr. Eric Kokert. I'm the medical director of the UPMC Pinnacle Harrisburg Emergency Department. And thank you for being here today to address this important public health problem. Sudden cardiac arrest is a life-threatening emergency that strikes people of all ages who seem apparently healthy. As we all know, this can include children and teens alike. Every year, emergency medical services professionals treat more than 350,000 patients each year with out-of-hospital cardiac arrest. Of these, greater than 90% will not survive. However, when bystanders intervene immediately, survival can increase 2 to 3-fold. Intervention should include activation of 911, initiation of CPR, and use of an AED when available. This is a compelling argument for making sure our first responders are fully prepared for such an emergency. We thank the UPMC Pinnacle Harrisburg Emergency Department nurses for taking the initiative to outfit the Harrisburg police officers with the critical equipment they need to help save lives. We are grateful for the UPMC Pinnacle Foundation for its generous donation and the Peyton Walker Foundation for providing the AEDs and training along with the equipment. And lastly, we thank the Harrisburg City Police for their service to ensure the greater Harrisburg area is a safe place to live, work, and play. Again, thank you all for coming today, and have a fantastic afternoon.